And welcome to Boston City Hall. Today marks just about 650 days since COVID-19 was declared a global pandemic in March of 2020, with the Commonwealth of Massachusetts and the City of Boston following shortly thereafter. We all remember the gravity and uncertainty as those early weeks turned into months, as schools were shut down, along with small businesses, childcare, and so many parts of our daily support systems. That winter, cases surged, and today we are facing another winter surge with the Omicron variant. But there is a key difference between last winter and today. Today, vaccines are available for every adult and even children as young as 5 years old. Through heroic efforts, community-led efforts, relentless outreach, nearly 70% of Bostonians are fully vaccinated, and nearly 80% have gotten at least one dose. Vaccination is the most powerful tool we have to fight this pandemic. Over the last month of our new administration, I've been in conversation with our COVID-19 advisory group. I'm so grateful for these leaders sharing their time with the leaders at our community health centers, at our hospitals and healthcare institutions. Over and over and over again, I have heard the same message. The vast majority of hospitalizations are of unvaccinated individuals. Our essential workers have been on the front lines of fighting this pandemic for more than 650 days. And it's time for Boston to follow the science and public health data to ease their burden, to take the big steps that we can to help close vaccination gaps. So today, I am very honored to stand alongside incredible leaders from across our region, across the administration, across the Boston City Council, across the state legislature, and so many of our cities and towns, sister cities and towns, to make an announcement together. Today we're announcing that Boston will be implementing a requirement for proof of COVID-19 vaccination for certain indoor spaces, which we're calling our Be Together initiative. Be Together will require proof of vaccination to enter indoor dining, well, three categories, just so you can keep the count. First, indoor dining, including bars and restaurants. Secondly, indoor fitness venues, such as gyms. And third, indoor entertainment, recreational, and event venues, such as theater shows or sports games. Starting January 15th, customers or patrons ages 12 and up and employees at these locations will be required to show proof that they've received at least one dose of the vaccine, and this will phase into requiring 2 doses on February 15th. We're also setting dates for children to be vaccinated to enter these spaces beginning in March. Yesterday, I went out to eat at a restaurant with my family. We had a delicious brunch at Article 24 in Brighton. We felt comfortable there eating with our masks off, as we're all vaccinated, except for my younger son, who's 4 years old and who has a test and stay program through the Boston Public Schools. The staff at Article 24 was extremely friendly and came and checked on us about 5 times throughout the meal. The proof of vaccination check would be just one more interaction that already happens between so many being made comfortable at our establishments and the incredible staff and workforce. It would be a quick glance at an app or a card or a photo of your card. One more quick check with tremendous support from city agencies in the form of clear guidance, signage, and training. Today I'm also announcing that all City of Boston employees must be vaccinated along the same timeline. I want to note and thank everyone who works for the City of Boston, because we are already at more than 90% of city workers vaccinated under the existing policy, which has either a vaccination or weekly testing option. And so we will be removing that weekly testing option to move for full vaccination. This is a response that is rooted in science and public health, and we need to take every available action to protect our city's residents, businesses, and institutions. Over the past few weeks, our team has looked at cities around the country to consider the most effective steps to encourage vaccination and keep Boston and our greater Boston region vibrant and open to all. We've spoken regularly with leaders in New York City, which instituted their vaccine requirement months ago. We've also spoken with leaders in cities and towns across the region, some of our leaders here today, to ensure we're building and sustaining a regional response. To be clear, this is just one step in an aggressive approach that the city has already been working hard to implement and will continue to ramp up in the coming days and weeks. But given where we are at this moment, it is absolutely a necessary one. We're ready to take this step forward to protect our residents, and we are prepared with actions to help our businesses too. For too many months and years, our businesses have been forced to act on their own. Many have already implemented proof of vaccination independently, taking on that burden on their own shoulders, along with so much else from the pandemic. Now we are setting clear standards that will provide straightforward guidance for businesses and ease that burden. We'll be engaging in comprehensive community outreach to individuals to share information and to businesses to lower the barriers to getting vaccinated. Starting tomorrow, we will have webinars available for our small businesses to understand and help support the implementation of these new requirements, and the ongoing information sessions will be all information shared on our website, boston.gov/B-together. This step will help increase our vaccination numbers, which we know is the best way to keep our communities safe and thriving. Although Boston's vaccination rates have been high, we continue to see serious disparities by race and by age, allowing Omicron and other new variants to spread in our communities. Vaccines are the most powerful tool in fighting this pandemic once again, and they are the most powerful tool to allow us to recover as a city and to truly be together. I'm so grateful to have regional mayors and municipal health officials here, city councilors, state representatives, because fighting this pandemic will require shared action and partnership. We are all connected, and these leaders are showing that we can work together to deliver change. So before I pass to our amazing director of the Boston Public Health Commission, Dr. Basola Ojikutu, I'm just going to do quick remarks in Espanol also, and then we'll shift over to the speaking program. Okay, buenos días. Me gustaría dar las gracias a todos los que nos acompañan hoy. Hoy se cumplen unos 650 días desde que el COVID-19 fue declarado pandemia mundial en marzo de 2020 y poco después la Commonwealth de Massachusetts y la ciudad de Boston. Todos recordamos la gravedad y la incertidumbre cuando esas primeras semanas se convirtieron en meses, cuando se cerraron las escuelas junto con las pequeñas empresas, las galerías y muchas partes de nuestros sistemas de apoyo diario. Este invierno los casos aumentaron y hoy nos enfrentamos a otra oleada invernal con la variante Omicron. Pero hay una diferencia clave entre el invierno pasado y el actual. Las vacunas están disponibles para todos los adultos, incluso para los niños de tan solo 5 años. Gracias a los esfuerzos heroicos, los esfuerzos dirigidos por la comunidad y la incesante divulgación, casi el 60% de los bostonianos están totalmente vacunados y casi el 80% ha recibido al menos una dosis. La vacunación es la herramienta más poderosa que tenemos para luchar contra esta pandemia. He mantenido conversaciones con el grupo consultivo de COVID, los responsables de los centros de salud comunitarios y los responsables de los hospitales y de la atención sanitaria. La gran mayoría de las hospitalizaciones son de personas no vacunadas. Nuestros trabajadores esenciales han estado en la primera línea de la lucha contra esta pandemia durante más de 650 días y es hora de que Boston siga la ciencia y los datos de salud pública para aliviar su carga, para dar los grandes pasos que podamos que ayuden a cerrar las brechas de vacunación. Hoy anuncio que nuestra ciudad va a poner en marcha la exigencia de una prueba de vacunación contra el COVID-19 para determinados espacios interiores, lo que llamamos nuestra iniciativa Be Together. Be Together exige una prueba de vacunación para entrar en tres tipos de espacios. 1, comedores interiores, incluidos bares y restaurantes. 2, lugares de fitness en interiores. Y 3, lugares de entretenimiento, recreativos y de eventos en interiores. A partir de 50 de enero, los clientes de 12 años en adelante de los empleados de esos lugares deberán demostrar que han recibido al menos una dosis de la vacuna. Y el próximo mes se pasará a 2 dosis. También se fijarán fechas para los niños a partir de marzo. Ayer salí a comer a un restaurante con mi familia. Tomamos un delicioso brunch en Article 24 en Brighton. Nos sentimos cómodos allí, ya que todos estamos vacunados, excepto mi hijo menor, que tiene 4 años y tiene un programa de prueba de permanencia en la escuela. El personal fue muy amable y vino a vernos unas 5 veces durante la comida. El control de la prueba de vacunación para echar un vistazo a una aplicación o a una tarjeta o una foto de una tarjeta sería un control rápido más, con el apoyo de los organismos de la ciudad en forma de orientación clara, señalización y formación. Y hoy también anuncio que todos los empleados de la ciudad de Boston deben ser vacunados en el mismo plazo, aunque me complace decir que más de 90% de los trabajadores de la ciudad ya están vacunados según nuestra política actual. Se trata de una respuesta basada en la ciencia y la salud pública. Tenemos que tomar todas las medidas disponibles para proteger a los residentes, las empresas y las instituciones de nuestra ciudad. En las últimas semanas, nuestro equipo ha estudiado ciudades de todo el país para considerar las medidas más eficaces para fomentar la vacunación y mantener nuestra ciudad vibrante y abierta a todos. Hemos hablado regularmente con dirigentes de la ciudad de Nueva York, que instituyó la obligación de vacunarse hace meses. También hemos hablado con dirigentes de ciudades de pueblos de la región del Gran Boston para asegurarnos de que estamos creando y manteniendo una respuesta regional. Para ser claros, ese es solo un paso en un enfoque agresivo que la ciudad ya ha estado trabajando duro para implementar y continuará aumentando en los próximos días y semanas. Pero, dada la situación actual, es absolutamente necesario. Estamos dispuestos a dar este paso adelante para proteger a nuestros residentes y estamos preparados con acciones para ayudar también a nuestras empresas. Durante demasiados meses y años, nuestras empresas se han visto obligadas a actuar por su cuenta. Muchos han implementado la prueba de vacunación de forma independiente. Ahora estamos estableciendo normas claras que proporcionarán una orientación directa a las empresas y les quitarán la carga. También vamos a emprender una amplia labor de divulgación en la comunidad, tanto con los particulares para compartir información y reducir las barreras para vacunarse, y a las pequeñas empresas para ayudarles a entender y aplicar fácilmente los nuevos requisitos, con sesiones informativas continuas que los empresarios pueden encontrar en nuestro sitio web boston.gov/betogether. Ese paso ayudará a aumentar nuestras cifras de vacunación, que sabemos que es la mejor manera de mantener nuestras comunidades seguras y prósperas. Aunque las tasas de vacunación de Boston han sido altas, seguimos observando graves disparidades por raza y por edad, lo que permite que Omicron y otras nuevas variantes se propaguen en nuestras comunidades. Las vacunas son nuestra herramienta más poderosa para luchar contra esta pandemia. y son la herramienta más poderosa para permitirnos recuperarnos como ciudad y estar realmente juntos. Estoy muy agradecido de tener aquí a los alcaldes regionales y a los funcionarios municipales de sanidad, porque la lucha contra esta pandemia requerirá una acción compartida y una asociación. Todos estamos conectados y estos líderes están demostrando que podemos trabajar juntos para lograr el cambio. Ahora me gustaría dar la bienvenida a Dr. Bisola Ojakutu.
Good morning, everyone, and thank you, Mayor Wu, for your leadership. I would like to describe why the city is implementing a multi-layered, comprehensive strategy to address COVID-19 that includes the requirement for proof of vaccination for certain indoor spaces, the Be Together initiative. Boston is currently experiencing a surge in COVID-19 cases. New cases in our city has increased almost 90% compared to 2 weeks ago, and we're now averaging 369 new cases per day. Our most recent citywide positivity rate is 6.7%. Hospitalizations are also increasing, and frankly, our hospital resources are already stretched thin. On average, 229 adults are hospitalized with COVID per day in Boston. This is more than 60% higher than it was 2 weeks ago. Among those who are hospitalized with COVID-19, an estimated 2/3 are unvaccinated. On December 15th, the Boston Public Health Commission announced the identification of the first 3 confirmed cases of the Omicron variant in Boston. Based upon what we know regarding the extremely high transmissibility of this variant, we anticipate that our case numbers in Boston will rise significantly in January. That is why the Be Together initiative is critical to protect our residents and our city. The sheer number of cases that we anticipate will have a severe impact on our healthcare system. As mentioned, our hospitals are already overwhelmed. As of last week, all Boston hospitals are now restricting non-urgent procedures. Our State Department of Public Health released additional guidance to hospitals that requires them to reduce non-urgent procedures by 50%. So what do we need to do to protect Boston residents and preserve our hospital resources? We have effective tools at our disposal. First and foremost, COVID-19 vaccines. Available data indicate that vaccination with boosting increases immunity and provides significant cross-protection to the variants that have emerged to date, and that includes Omicron. Critically, the data indicate that vaccination will decrease the risk of severe hospitalization and death from COVID-19. Unfortunately, in recent weeks, the number of Bostonians who have been newly vaccinated has stagnated. As of December 14th, 79% of Boston residents have received 1 dose of a COVID-19 vaccine, and 68% are fully vaccinated. Only 31% of Bostonians who are fully vaccinated have been boosted. And among 5 to 11-year-olds, only 30% have received their first dose of vaccine. As Mayor Wu mentioned, significant racial and ethnic disparities persist, particularly among our youngest populations and among those who have been boosted. I believe that we can and we must do better than this. This is why we're implementing the Be Together initiative. Indoor vaccine mandates and mandates in general increase vaccination rates. After New York City implemented its indoor vaccination mandate, known as the Key to New York City program, citywide vaccinations increased by 9% in just 1 month, and the number of doses administered has risen steadily since implementation. Though the policy that will be implemented here in Boston will not currently include booster dosing, we see this as a critical first step to encourage new vaccination uptake, and we will adjust the policy as needed when the definition of fully vaccinated changes. Along with this new policy, we must increase vaccination access. Everyone in Boston who wants to be vaccinated and boosted must be able to get a vaccine or a booster. If you are unable to access a vaccination appointment through your local pharmacies or hospitals, We strongly encourage you to access our family-friendly clinic sites offering first and second doses for 5 and up, as well as booster doses. This week, there are family clinic sites available for walk-in throughout the city. Through the end of December and January, we will also continue to operate higher capacity community-based vaccination sites, including at the Tobin Community Center, at the Vine Street Community Center, at the Melnia Cass Recreational Complex, and right here at City Hall. In addition, at least 6 new sites will be open throughout the city of Boston in collaboration with the state. All of these site location times and dates will be available this week via boston.gov, 311, or the Mayor's Helpline. And as you're probably already aware, the state also plans to open Benway Park to increase vaccine access in January, and we will be working with them to ensure residents from across the city have equal access to that site. Increasing 5 to 11 vaccine access at schools is also critical to address known disparities. Therefore, 24 on-site school clinics are scheduled for Boston Public Schools through February 2022, during which first doses, second doses, and boosters can be obtained. And more clinic sites are being scheduled. We encourage you to get your child vaccinated at one of these publicly available sites or on-site at Boston Public Schools. While we are increasing supply, we must also increase demand. This past Saturday, we held a high-capacity vaccine clinic at Melnia Cass Recreational Complex, and I'm proud to say that we vaccinated 649 people. But we had the capacity to vaccinate 800 people. We believe that the Be Together initiative will increase demand for vaccination, and we will be ready to meet that increased demand. So I mentioned when I opened that this is a multi-layered, comprehensive strategy. Rapid antigen testing is an important aspect of our citywide plan. Starting today, rapid antigen test kits will be available for free at 14 sites throughout the city of Boston. At Boston Public Libraries, at Boston Centers for Youth and Families, and we are partnering with BHA, or Boston Housing Authority, and Boston Public Schools to make rapid antigen testing available for free to those who need them. I also want to mention that this particular policy is not instead of indoor vaccination. Our indoor mask mandate remains in place throughout Boston. Bracing for a new variant and dealing with a winter surge is certainly not what any of us hoped for. Though we are all tired and we are frustrated, I'm sure, we must continue to press forward to protect the health and well-being of ourselves, our families, and our communities. Please remember that all of our prevention strategies are important. Continue to wear masks indoors, wash your hands frequently, monitor yourself and your children for symptoms, get tested, get vaccinated, get boosted, and we will get through this together. Thank you.
Welcome to the People's Building. I just want to emphasize, there is nothing more American than coming together to ensure that we are taking care of each other, that each and every one of our community members is safe, is healthy, and has access to the future and the opportunities they deserve. So I'm proud to stand with so many in this effort. I want to just quickly recognize the elected officials who are here with us before I pass it on to Mayor Curtatone. So thank you to City Councilor Matt O'Malley, State Representative Nika Lugardo, Councilor-elect Tanya Fernandez-Anderson, City Councilor Ed Flynn, Councilor Kenzie Bach, Mayor-elect Tatiana Ballantyne, Mayor Curtatone, who you'll hear from in a second, Select person Raul Fernandez from Brookline, Mayor Kim Driscoll from Salem. You'll also hear from Senator Will Brownsberger, City Councilor Lydia Edwards. You'll hear from Councilor-elect Ruthie Louijean and Councilor-elect Brian Worrell. Thank you so much. Now passing on to a partner who has been such a leader to coordinate efforts regionally, who has also brought his successor along with him, Mayor Joe Crittenden.
Good morning. Thank you for being here. My name is Joe Crittenden. I'm the Mayor of Somerville, and I'm also joined by the incoming Mayor-elect Katiana Ballantyne, as we work on close coordination on all matters of transition, especially matters of significant importance, such as how to continue to attack the pandemic and keep people alive and well and safe. From the very beginning, cities and towns had to come together on their own. More than 351 cities and towns in the Commonwealth, 400 school districts had to figure it out on their own. When the state abdicated its responsibility and it fell on deaf ears, our call for regional approaches, we did what we needed to do. Our most important responsibility to all of you, and we represent everyone, is to keep you healthy, well, safe, and alive, because we cannot get to the other side of this thing, or we cannot have a healthy recovery to our economy without a healthy society, and that means everyone. Everyone. In the next couple of weeks, Massachusetts will eclipse 20,000 deaths, one of the highest death rates in the nation for a state so wealth enriches healthcare, research that is unacceptable. More than 800,000 in this nation, 5 million worldwide. I am done with COVID. I know you are. It is not done with us. We either control it or it controls us. We have the tools. Wear a mask when you should wear one. Get tested and get vaccinated, because vaccines save lives. I am sick of the phone calls I get. 99 people now in Somerville. We get the calls. Who's died, who's losing their home, and who's losing their business. We are not fighting the economy. We're fighting the pandemic. I'm glad to hear the national anthem in USA. As Mayor Wu said, there's no greater example of living up to our American ideals in spirit than that selfless sacrifice on behalf of friend and neighbor and community. Sacrifice on them, getting them fed. City leaders came together March 12, 2020 in Somerville, Massachusetts. Communities large and small, rural, suburban, and urban, took action in our own hands when the state wouldn't. We had to close schools, roll back different activities in our community, figure out how to do pool testing. Now you see it across the state. Get testing access to the most vulnerable in our community. And these are the people that are dying the most. Black, brown, poor, elderly. How many lives and souls should we forsake? This is not about anyone's conveniences. I'm not here to fight for your conveniences, because fighting for conveniences means you continue to put a burden on us. It is the unvaccinated that are killing us right now. We know what to do. Let's get through this together. We represent all of you. I want to applaud Mayor Wu, the City of Boston, for their leadership. That is what we need. I want to applaud all the municipal leaders, and I currently have been chairing the Metropolitan Mayor's Coalition now for a decade, 15 cities in the Metro Boston core. I speak for Somerville, along with my colleague, the Mayor-elect of Somerville, a great leader, Katiana Ballantyne, and we will be seeking Board of Health consideration of a similar measure in Somerville, as others will. You'll soon hear from a great municipal leader, Mayor Kim Driscoll, who with me, along with others, facilitated regional coalition calls, and along the way now for almost 3 years, we have been deliberate together, following the advice of epidemiologists, the highest level healthcare experts, researchers, because we had to fight for that information on our own. We need to continue to bond together and take this on. We need the state to step in and order these measures. We shouldn't have to fight for them. How many more lives do we have to lose? This is important. I know we're done with it, but it's not done with us. We can get there, and we know what works. And for those communities who don't have these measures in place, I want those residents to speak up louder than what you're hearing here and demand that be placed in your city and town. You demand it, because that's what you deserve. That is the core responsibility to what we should be doing in public office, is the health, well-being, safety of your lives, no matter who you are. God bless America is right for everybody. Let's keep everyone safe. Thank you.
Thank you, Mayor Crittenden. Next up, Salem Mayor Kim Driscoll.
Good morning, everyone, and I want to thank Michelle Wu for bringing us together to act collectively. There's no doubt that today's announcement is about our communities versus the virus. That's where we started, and that's where we are today. For so many of us, we have lots of residents who are vaccinated, over 70% in Salem. But if you peel that number back, only 50% of our young adults are vaccinated. 1 out of 2 people between the ages of 16 and 29 in my community and many others. Our hospitals have no wiggle room. Our hospital presidents have made that clear. In order to keep our businesses open, keep our communities safe, ensure that our kids can stay in school, we need to act collectively. Requiring a vaccine for entry into restaurants, fitness centers, entertainment venues is a small price to pay and a tool in our toolbox that we should be using to keep our communities safe, strong, and open. I'm proud to be here today, proud that we're going to act collectively. Know that there'll be many local leaders, local boards of health, volunteers who have been doing yeoman's work over the course of the last year, who are going to look at this action and collectively come together. Every city and town cares about the people who live there. Let's make sure we're using every tool in our toolbox to keep everybody healthy. Happy to be here, happy to support this.
Thank you, Mayor Driscoll. Next up is Brookline Select Board Member Raul Fernandez.
Thank you, Mayor Wu. Thank you all for being here today. Let me tell you, I'm the vice chair of the Select Board in Brookline and also the chair of our Small Business Development Committee. We had a conversation about this very issue last month, and our business community is united in ensuring that our folks in our communities and in surrounding communities can safely come into their businesses, into their restaurants and things like fitness centers and entertainment venues, and they know the same thing that we know, is that people require confidence that they're going to be safe and that they're going to be able to keep their families safe if they go out and participate in our local economy. So let's set that aside. We also have some business owners that will be with us today, including business owners from communities of color, who are going to attest to that need right there. What I can tell you is that this is about us for sure, but it's also about our neighbors. It's about our immunocompromised neighbors. It's about our older neighbors. It's about our children. And it's about making sure that all of those folks, all those essential workers who we know are frontline workers, but in the pandemic, what we've realized is that essential workers also include bus T drivers. They also include grocery store workers. They also include front and back of the house staff at our restaurants. This is about keeping us all safe, especially those of us that cannot just ride out a pandemic behind a Zoom screen. Okay, so when we say about coming together, we're talking about doing that for those who need it most. This is a major move. I'm very excited that in Brookline, we're going to be having this conversation. Tomorrow night, we'll be talking about this on a select board. Our Advisory Council on Public Health is going to be talking about this. And I'm very confident that we're going to move. This region, as you heard from Mayor Curtatone, this region requires Boston to take major steps and for us all to work together as a community amongst communities. So I'll be there for Mayor Wu, I'll be there for this community, and I look forward to working with you all to making sure that we can keep our communities safe and vibrant for those folks who need it most. Thank you very much. Appreciate you.
I'd like to invite up Councillor Ed Flynn on behalf of the Boston City Council to say a few words too.
Thank you, Mayor Wu. Representing my colleagues in the Boston City Council, we stand with the mayor and her team today. This is a difficult decision the mayor made, but it's based on science. It's based on the recommendations of public health professionals, and during these difficult times we must come together as a city and be united to make sure we speak and support our immigrant community, our communities of color, our young people, persons with disabilities, to make sure that they have access to vaccinations, but also that public health is the most top priority in city government. Again, on behalf of our colleagues in city government, we stand with the mayor because this is the right decision she made today. Thank you.
Okay, we have a couple more speakers representing various other coalitions and industries and communities. Next up is Mark Drayson, Executive Director of the Metropolitan Area Planning Council.
Well, nobody said it was going to be easy. I want to tell you that I am here with a great deal of hope today. There's a lot to worry about, there's a lot to be sad about, but I have a great deal of hope because we have a mayor who has acted quickly, she has acted decisively, she has followed the science, and she is bringing other communities with her. And I know, having lived in this city every day of my life, that the vast majority of the residents of this city, and in fact of this region, are with her. As the holiday season comes, people want to be revelers. They don't want to be mourners. And we all need to do a few simple things to make sure that happens. Get vaccinated, get boosted, wear your mask indoors at public events, show your card. These are not hard things to do. They're not un-American things to do. They're very American things to do to protect all of us and our neighbors. And I want to thank Mayor Wu for her leadership. We at the Metropolitan Area Planning Council will be working with cities and towns throughout the region who want to adopt this worthy policy, make it work in their communities, and keep our people safe. Thank you, Mayor Wu.
Thank you, Mark. Next up, Dini Paulina, CEO of La Colaborativa in Chelsea.
Muy buenos días. Good morning. My name is Tinangeli Paulino. I am the Chief Operating Officer of La Colaborativa and a longtime resident of Hyde Park. I'm here to support Mayor Wood proposed vaccine mandates for indoor dining, indoor entertainment, and indoor gyms. As a front-line worker in Chelsea, one of the communities most affected by the pandemic last year, a community of low-income essential workers and that travels back and forth from their home to their jobs, a majority immigrant community that already marginalized by low-income paying jobs, overcrowded housing, and other social determinants of health that makes them more vulnerable to the infection from COVID. 2 years ago, we didn't know what COVID was. We didn't know the virus. We just know that for some it was deadly. We lost a lot of lives. Our essential workers, some of us had the opportunity to stay home, our essential workers continue going to work, putting their lives at risk to bring some normalcy to the rest of us. They serve food, they package meat, they clean public spaces, and even though they had fear that they were going to get sick, lose their lives and the lives of their loved ones by bringing COVID back home, they continue to work. They work tirelessly to ensure that the rest of us kept normalcy. Today, with this new requirement, we take a step forward in protecting our essential workers and ensuring a safer workplace for them, their colleagues, and their clients. I have witnessed the preventable deaths of many neighborhoods, many neighbors and family members that were essential workers that needed to work, left their houses because they needed to survive. Witnessed many workers to go to work sick because of fear that they were going to get fired. Now most of them are vaccinated, and they still have to go to work and with the fear of potentially bringing the virus home to their children, their loved ones, or their elderly parents. Our economy benefits from these workers remaining healthy, and it makes business sense to protect them. Essential workers were the first one to get the virus, were the first one to lose their job, and the last one to get vaccinated. Let's ensure essential workers in certain business sectors receive the protection that they deserve. I thank Mayor Wu for her leadership and the leaders of Boston and other regional mayors to support this initiative. Thank you. Should I do it in Spanish? Muy buenos días, mi nombre es Dinangeli Paulino, soy gerente general de la colaborativa y residente de Boston. Hoy aquí estoy en día para apoyar la alcaldesa Wu en estar segura de que todos los apoyando el mandato de vacunaciones para lugares de entretenimientos encerrados, de restaurantes encerrados y de gimnasios encerrados. Como trabajadora esencial en una de las comunidades más afectadas por el virus en nuestra comunidad, es una comunidad de bajos ingresos, de personas que viven en espacios muy pequeños y que fueron afectados drásticamente económico en su vida. 2 años atrás nosotros no sabíamos mucho del virus. Lo único que sabíamos es que los trabajadores esenciales no tenían la opción de quedarse en su casa, de que ellos tenían que salir a trabajar para mantener a sus familias. Esos trabajadores esenciales fueron los primeros que se enfermaron, los primeros que perdieron el trabajo y los últimos en poder vacunarse. Es hora de que los protegemos a ellos. Hace sentido que nosotros le demos la protección que ellos necesitan para seguir esta economía. Muchísimas gracias.
Okay. Great. So as we transition, before we transition into some leaders from our small businesses and industries across Boston, I'm very excited to bring up our incoming Chief of Opportunity and Inclusion, Shagun Idowu.
Good morning, everyone. Good morning, everyone. So first, I want to thank Mayor Wu, Dr. Ojikutu, and all of the dedicated public servants who have, to this day and with this decision, helped to save lives. That's the most important thing that we should take away from today. I am just going to be here briefly just to say that in speaking with many business owners, even in my previous role, this is a decision that I know is bringing a lot of relief to small business owners throughout the city of Boston. They've been waiting for a decision like this to be made. What this ensures is that we're not only saving lives, but saving livelihoods. Our business owners who have received millions in small business grants throughout the year, this decision is going to help ensure that consumer confidence is also boosted. When a patron is going to a restaurant and they know that the person they're sitting next to is vaccinated, when they go to a fitness center like TrillFit and know that their instructors are vaccinated, this is what's going to encourage people to leave their homes to go out and support our small businesses. So again, I want to say thank you to our mayor, to our City Hall team, to all of the leaders who are here, elected and otherwise, who are helping to ensure that we're not just saving our people, but also our small businesses. So thank you all very much.
Thank you, Chief. Now I want to invite up a trio of restaurant owners, Brian Moy, Bessie King, and Nancy Caswell.
Good morning, everyone. Let me introduce myself. I apologize. Nancy Caswell. I own restaurants in Boston and in Newburyport, and I sit currently as the executive director for Massachusetts Restaurant United, a coalition established at the beginning of the pandemic to work together and advocate for our restaurants. The last 22 months have been the most challenging months for our independent restaurant operators. Our restaurants have followed the guidance of the government each step of our reopening, and today we stand with Mayor Wu moving into this next chapter. If public health experts and our mayor believe that proof of vaccination is in the best interest of public health, we too stand behind that decision. As operators, we continue to jump hurdles to establish safe and healthy dining rooms for our employees and guests. Our neighbors have reestablished new trust in us, and we ask that the next step is taken to support our industry. While all of this is uncharted territory, Massachusetts Restaurant United is confident that together restaurants will find the strength we need to face the next several months. It's without question that this will be difficult to execute while some of us experience labor shortages and real burnout. But we can try to do the best that we can and for the ability for the sake of greater good. Over the last 2 years, Massachusetts Restaurant United has learned that united we are stronger and louder. Let us navigate these waters together under the direction of our city's leadership, with big hopes that this can help us get out on the other side of the pandemic as we learn how to live and work with COVID.
Thank you. Good morning. My name is Bessie King. I am the co-owner and operator of one of our cities and states' first authentic Mexican restaurant. We've been in operation for 22 years. And the one thing that kept us surviving COVID was relying on our community. We stayed open for our employees to make sure that they maintained some sort of livelihood, and we have chosen to be safe and follow COVID regulations for those people, for the wage workers that keep our businesses running, for our employees that keep Boston running and our state running, and we are very thankful that at last this administration has taken definitive and fast steps to continue protecting our employees, because without them, we do not have businesses. With this mandate, we will ensure that our employees are feeling safe and comfortable to return to work and be able to reopen and continue restructuring and rebuilding our businesses. Because unfortunately, we have faced selfish and rude patrons who put their comfort first before the safety and protection of our employees and our teams, our people, our quote-unquote minorities that keep our city and our state running. This mandate will ensure that we can continue keeping our community, a community for all, safe and fit to move forward. Buenos días, mi nombre es Bessie King, soy la dueña y operadora de Villa México Café en Boston, y por muchos años ya hemos estado como miembros de la comunidad y como líderes en nuestra comunidad. Este mandato nos va a ayudar a asegurar que nuestros empleados, todas esas personas que mantienen a nuestra industria siguiendo adelante, puedan regresar a trabajar, porque sin ellos no hay ciudad, sin ellos no hay negocios. Entonces le agradecemos a nuestra alcaldesa por tomar una decisión definitiva para proteger a nuestra gente, a nuestros trabajadores, para que podamos seguir adelante y estar seguros ahora que COVID vuelve a resurgir con una nueva variante. Les agradecemos a nuestros clientes, pero tenemos que asegurar la protección y la salud de nuestros trabajadores para poder seguir saliendo adelante y ofrecerles nuestros servicios. Este mandato nos va a ayudar a conseguir eso. Gracias.
Good morning, all. My name is Brian Moy. I am owner of China Pearl Restaurant in Boston and Quincy, and Shoujo Restaurant as well. I stand here today with the mayor and other restaurant owners in support of this mandate that is going to be important to try to fight this with COVID. We need to be part of addressing this winter surge of COVID, and this is a forefront. We know that getting more people vaccinated is the cure to this. Protecting our staff, our customers, and our community is of utmost importance. As member of the COVID Advisory Board of Boston, I thank Mayor Wu for making this difficult decision and also for including and being communicative and listening to the small businesses' thoughts and repercussions of what this can do for our business. Restaurants are safe to eat in, to dine in, and we're here to protect the people as much as we can. There will be more questions days ahead, and we're confident, as I am very confident, that we will work together to make this as easy and as smooth a transition as possible. And I thank all the other representatives that are from the different cities and towns of Massachusetts to stand together to do this all as a group. I would like to take this moment to address the Chinese community as well. 我是叫梅佩佳，我 Brian Moy 是 China Pearl 跟 Shoujo 的老板。今天我很感谢 Mayor Wu 站出来，是叫我们大家做生意的人一起站起来，有意见，我们怎么可以把这个 COVID 的事情最好是把它解决。 我们知道大家去打这个 vaccine 是很重要，我们需要伙计、客人跟我们的 community 的人一起去打针才可以。我是在参与他这个 Boston 的 COVID Advisory Board， 然后 Mayor Wu 很感谢我们可以大家做生意的人一起有意见，可以去把这个商量有困难的东西，我们大家去解决这个问题。谢谢 ，Thank you。
Okay, 谢谢 Thank you so much, everyone. Next up, Heather White, a personal inspiration of mine. I'm going to make it to the gym sometime. Of TrillFit.
Good morning, everybody. Thank you so much for having me here. My name is Heather White, and I'm the founder and CEO of TrillFit, a boutique fitness studio here in Boston, broadcasting globally. We were actually the first studio in the city to close because of COVID-19, and our community supported us. Not one person canceled their TrillFit membership because they appreciated that we took a stand for public health. Now at TrillFit, we have a manifesto that we live by, and the first line is, I am not well if we are not well, and we are not well if we are not vaccinated. So we stand here proud to support Mayor Wu and her team's leadership as we trust in science, we believe in the experts, and we move forward to do what it takes to slow the spread of COVID-19. Thank you so much, Mayor Wu.
Thank you, Heather. And our final speaker on this portion, Temple Gill of the Huntington Theater.
Good morning. The Huntington Theater Company requires vaccinations, thank you, for all of our staff and artists, and has been requiring masks and checking for proof of vaccination or negative COVID test of everyone entering our venues since we reopened for live indoor performances back in August. These vaccine checks have been going very smoothly, and our audiences have greatly appreciated these safety precautions. In fact, 50% of Boston's arts audiences have said that requiring masks and proof of vaccinations is the minimum level of safety protocols required for them to attend an indoor event. Thankfully, we know that the vaccination rate of our audience and of the Boston arts audience in general is very high. About 98% are vaccinated. We support Mayor Wu and the City of Boston's decision to require proof of vaccination for indoor entertainment venues. It sends a strong message encouraging everyone to get vaccinated. The city's leadership in requiring masks and proof of vaccination means that arts organizations don't have to shoulder the responsibility of these decisions alone. It eases the burden on our staff who implement and enforce these protocols with vigilance. We all want to keep our doors open, and we appreciate the mayor taking these steps for the economic recovery of our city. Arts and culture is a tremendously vital part of what makes Boston such a wonderful city to live in, to work, to visit. The pandemic has already had a devastating impact on the creative sector, and we all must do everything we can to stop the spread of the virus. Thank you.
Okay, I'll open it up for questions now and draw in folks here and there. I want to start with one question that I've gotten several times already, which is why phase this in starting with just one dose instead of starting with 2 doses right up front. This is to ensure, the goal of this policy is to ensure that we are safe, and this is to increase vaccination rates. And so we need to give time for members of the public and for staff and the workforce at these businesses who will also be asked to show proof of vaccination to get vaccinated, to keep coming to work. And so this timeline allows for everyone to receive their first dose if they have not yet already, and then to get their second dose and phase it in as quickly as possible with the required time in between. I'll also mention, sorry, I see you, Charmin and Danny, also mention that Dr. Ojokutu and I will be hosting an Instagram Live this afternoon for members of the public who have questions, so you can follow us then. You can go to our Instagram and then ask questions live at that point as well. So for the media, Charmin. The question was around how the city will be supporting our small businesses with enforcement, especially given feedback about how sometimes challenging it can be to enforce the mask mandate already. So we've learned a tremendous amount from our partners in New York City and other places. Cities across the country are already implementing this, and once it gets to the point that it is part of the culture, part of the standard expectation, there's much less direct challenge in compliance. As we ramp this up, the city will ensure that we are providing the resources. We will have signs available to pass out to our small businesses or downloadable and printable from our website, daily webinars, and we will ensure that we are doing this in a way that supports ongoing efforts. This will happen with our Inspectional Services Department, not through any public safety agencies, and we will partner with restaurants to ensure that this is restaurants, gyms, businesses that this applies to, so this is smooth and we are investing in the infrastructure to support compliance. So the question was on the city worker part of this and whether this needs to be negotiated and whether the test option should stay as an alternative to full vaccination. We are in conversations with all of our city unions to proceed along the processes that are required. As the initial policy was implemented that had both options, a similar process is underway for this update of the policy. We know that as cases go up, it is necessary to protect everyone who interacts with city government to have full vaccination among the workforce, to avoid any more outbreaks in our schools that could happen from unvaccinated teachers or staff in schools, to avoid any unnecessary transmission from city services. This is meant to keep each and every one of our city workers safe. And again, we are already at more than 90% of our workforce vaccinated. I'm confident that that number will continue to grow as we host on-site clinics in partnership with each of our departments. This is a requirement that will keep all of our workforce safe in City Hall and in the community. We are going to work in the coming weeks with each one of our city unions to arrive at the provisions that can be incorporated into contract negotiations, and in the meantime proceed in updating our policies, providing training, increasing access to boosters and to vaccination, but this will be a condition of employment for the city of Boston as it's phased in. In terms of restaurants and gyms and entertainment venues, similar to other cities, there will be a phased-in approach with a tremendous amount of outreach, of engagement, support, but we will be enforcing this with penalties and fines down the road for businesses who are not yet complying. But that is down the road as we work very, very hard to ensure we're in conversation and providing every resource possible. And I'll open this up to any of our other mayors or electeds. Yeah, I'll repeat it. The question was, in an issue that is divisive, how do we bring people together on this? Part of this, from the City of Boston's perspective, is doing this collectively and ensuring that we are taking the burden off of our local organizations and businesses who are having to make decisions on their own and face the consequences of having a patchwork out there. Consistency, clarity, and shifting the culture will help with that. I'll pass it on to Mayor Curtatone.
Just to add, I submit it's not. The overwhelming majority of people we know, the polling, support this. In our community, I can attest with the business organizations we work with, between the Chamber of Commerce's, the local first businesses, the business welcomed them. My own gym in spring on their own, when you could wear a mask if you were fully vaccinated, put in a vaccine requirement. People were proud to show that card. All right? The overwhelming majority of people want it. How do we deal with it? We need to be ethical about what is true, what we know, and why we're doing things, and engage, like Mayor Wu was doing together, bringing broad-based coalitions within our community, which we have in Somerville, working everyone to understand how we roll out in a very practical, meaningful, and effective way, and communicate. Thank you.
Okay. Would any members of our COVID advisory committee want to weigh in on this question? We're good?
I just want to add that during this process, we've spent an enormous amount of time in community engagement. One part of that has been convening the COVID-19 Advisory Committee, which has a multidisciplinary group of individuals from multiple different sectors, and getting their input. And by and large, all of them were in favor of this move. Secondly, from the Boston Public Health Commission perspective, we've been having community meetings regularly to see what people think, to see if we're reaching the right people, to see what information they need to be able to implement this policy. So community engagement has really been central to this initiation.
The question was on the number of city workers who are on unpaid leave as of today. I don't have the exact numbers here, but we can definitely follow up, and we'll have that we'll share that by our Instagram live time. Yes. Okay, the first question was on major events like First Night and whether they will be affected. With First Night is an outdoors event, and so this policy only applies. Well, first it won't kick in until January 15th anyway in terms of first implementation. But outdoor events where people can safely space apart are not intended to ever be covered by a policy like this. At the point where outdoor dining will overlap with this, outdoor dining is not subject to any sort of proof of requirement, for example, anyway. So activities like that are outdoors are largely not covered. And then there was a question from the public, I believe, about how do we know that this will be effective, given that there are breakthrough cases, given that there are cases where testing happens and yet there are still continued cases, and will this be a barrier, particularly for communities of color? There are breakthrough cases. Vaccinations do not prevent every single case of COVID-19, but what we do know is that when you are vaccinated, you do not get nearly as serious a case of COVID. As was stated before, the vast majority of hospitalizations are of unvaccinated individuals. So you are much more likely to get the virus, to transmit it if you are unvaccinated. For those who are vaccinated, when there are breakthrough cases, they are much, much more likely to be mild or have no symptoms whatsoever. And so it is still extremely important to make sure we're closing gaps in vaccination for the safety and health of our communities, for the strain on our healthcare workers and our hospital systems.
So I just want to add that, as I mentioned earlier, there are significant disparities in regards to vaccination uptake. We know this by race and ethnicity. We're at a point where we basically flatlined in terms of the number of new people who are becoming vaccinated. So we have to implement something to protect not only individuals, but people's families and communities from COVID-19. I think that this policy is right on time, and I think that it will be effective. Primarily because of what we've seen in New York City. They saw an uptick in vaccinations across the board immediately following the implementation of this particular policy, which is what we based our policy on. So we will see an increase in vaccinations, and I'm looking forward to coming back to you and giving you updated information where we see, upwards of 90% of Bostonians who are fully vaccinated.
Okay, are we good? Aaron, are you good, Soraya? Okay, last question here was on, is there a specific number of city workers who are impacted, and will there be any financial help to make sure that there's compensation for this? I will have to get back to you on the number and the policies. We are updating our existing COVID-19 vaccination policy to remove the testing opt-out, but as that was implemented with our union and collective bargaining processes, this will be as well. So but I don't have the number off the top of my head. Okay, thank you everyone.